Welcome, everyone, to another episode of the Scuttlebutt. Before we dive into the episode, we are very proud to welcome and celebrate our first sponsor. D&D Metal Recycling and Auto Salvage began as a small hauling and used auto parts operation in the Pittsburgh area in the late 1970s and has grown into a full-service metal recycling company with two locations, Lawrenceville and Tarentum. These are state-of-the-art scrapyards with deep roots in the community and a strong commitment to the service of their customers. D&D accepts all types of metal, both ferrous and non-ferrous, that may be generated by industrial manufacturing, construction and demolition, small commercial entities, as well as individual customers. They have a wide variety of material handling equipment and are capable of managing any job in a timely and efficient manner. You can contact them for quotes and availability at dndautosalvage.com. That's D and D autosalvage.com. Thank you, D&D, for supporting this podcast. And now, on with the show.
That's my hope and my prayer. I want every victim to move to Survivor once they move to Survivor, and then I want every survivor to be able to thrive in the new normal. My new normal, I didn't even think it would be this good.
Welcome, everyone, to the Scuttlebutt, and welcome to part 2 of our discussion of military sexual trauma with Dr. Karczynski, Timothy Jones, and Ryan All. We knew that this was going to be an in-depth conversation, so we split it into 2 conversations. If you missed part 1, please do check out our website at veteransbreakfastclub.org or go onto YouTube, and you can find part 1 of our conversation. That will help you to lead into this part 2. And thank you again for joining us. If you have any comments or suggestions that you would like to make to the Scuttlebutt, you can do that at Sean, that's SHAUN, at veteransbreakfastclub.org. And thank you again. And another of the myths that I recently read an article on was the idea of fake reports or false reports, and that within the article it stated this a psychiatrist in the Army, I believe, said, "I've never gotten a false or fake report." That's something that you might hear about, but it's definitely a myth.
So with that, I subscribe to that. False reporting does happen, but it is to the point where the percentage, the data, I believe, Dr. Karczynski can speak more towards the data, but I believe the data shows that is very, very few. Like and I believe it's like a less than a percentage point. I don't know the percentages, but I do know that it does happen, but that is, the odds are that you're getting a fake report are very slim to none.
And it's something that, also Task and Purpose reported on. We mentioned Scott Stevens' name earlier. He's actually, along with other soldiers, put together a guide meant to serve as an educational resource for leaders to better understand gender discrimination and issues women face in the Army. He got some press on this, and the guide you can find at companyleader.themilitaryleader.com. I wanted to put that out there as it became up as part of my research. Moving on from this here, we wanted to also bring up some other points that Dr. Karczynski can bring up about the VA. And I think to start, you talked about the VA's universal screening for MST and what that data shows. And I want to make sure that Dr. Karczynski, you could touch on that.
Right. So the VA started screening about 20 years ago when we were directed to by Congress. And we are continually rolling this data up and refining our numbers. And as I mentioned earlier, what we're finding is that 1 in 3 women and 1 in 50 men have told their VA providers that they had that an experience that occurred on that spectrum of military sexual trauma. Mm-hmm. And one of the reasons I'm so proud to work at VA is that VA offers free healthcare for physical and mental health issues related to military sexual trauma. And so sometimes I'm asked, well, would this be covered? Would this be covered? And I say, there's no list. There's no list of things that are covered. And this was, again, very intentional. This is between a veteran and the veteran's provider to determine, is this something that was related to military sexual trauma? So I think this is the only thing in VA that veterans are not charged for. and you don't need to have a particular diagnosis. You don't need to be service connected. You don't need to have filed a report. You don't have to have any documentation. Again, this is just the word of the veteran and a discussion with their provider, and that is enough. And again, I think that that was very intentional to cover as many possible physical and mental health issues that may arise from any kind of military sexual trauma. So can I talk a little bit about some of the things that,
of course,
people may be needing to be on the lookout for. And one of the things that is so personally difficult for me is working with veterans who it may have taken them years, or in some cases decades, to finally seek care. And unfortunately, it is the burden of shame and guilt that keep people from seeking care and seeking benefits. And so I do want people and listeners to be aware of some of the signs and symptoms that they may have some issues related to military sexual trauma. And there's not a single way that people respond to trauma, and it certainly is on a continuum. But I would encourage people to be just checking in with themselves. Are they experiencing some problems that may be related to, let's say, a psychiatric diagnosis? So when we think on the mental health side, some of the diagnoses that we're not surprised to find are post-traumatic stress disorder, depressive disorders, anxiety disorders, drug and alcohol problems. And I'm also going to include schizophrenia and psychotic disorders. And that maybe some people may kind of be confused about that. But when you think about the trauma of a sexual assault and an individual who may be vulnerable to schizophrenia, that type of trauma may constitute the first psychotic break, that may be the trigger for the first psychotic break. And so we can see the development of schizophrenia or other psychotic disorders in individuals who are vulnerable to those kind of disorders. We also see on the physical side, we know that people may be aware that they have contracted a sexually transmitted infection from a sexual assault, GI problems, ongoing pelvic pain, dental issues, including TMJ. And so these are some of the physical things that people may experience in terms of diagnoses. But we also know that there are other problems that may arise for individuals that they may not right away think that it's related to an assault that they experienced in the military. So individuals may be aware of extremes of emotional that's difficult to regulate. They may find that they are disengaged emotionally and are flat. They may have difficulties with attention, concentration, sleep disruption. They may have strong reactions to reminders of the traumatic event that may seem to come out of the blue. I mentioned sleep disruption. They may experience trauma-related nightmares, so nightmares of the traumatic event that play over and over. Suicidal thoughts, self-injury or self-injurious behavior, difficulties or disordered eating disorder problems. And I mentioned earlier, drug and alcohol use. So these difficulties, again, may constitute or may point towards being related to military sexual trauma. So we want folks to be aware that those are signs and symptoms that they may want to follow up on. I mentioned one of the barriers that I often see in terms of why people don't present for treatment, and that's the burden of shame and guilt. But another very significant reason people don't present for treatment is just plain flat out avoidance. They want to avoid thinking about it, talking about it, dealing with it. And so they may avoid seeking treatment. This may generalize maybe if they will avoid, as I mentioned, people may have strong reactions to reminders of the trauma. Well, this could extend to, I'm not going to go for any of my medical appointments that might involve being touched or some kind of an intrusive exam. Maybe I'm going to avoid any dental work. So they may start to avoid medical appointments. So we want to be always aware that, and I always tell patients that I work with, I get why people avoid, because in the moments that you avoid, you're not feeling anxious or distressed. But if that was really a long-term solution, you wouldn't have some of these other difficulties that you're having. So shame, guilt, avoidance, three, I think, really key reasons why people don't seek treatment. And I would encourage people to just be checking in with themselves. You know, is this true for you? Or are these some of the reasons you may not be seeking treatment at this time? And I'm wondering, Timothy, if any of that resonates for you.
Dr. Karczynski, I feel as though you just took a crystal ball and looked into the last 22 years of my life, because especially the first decade, I was drug and alcohol riddled. I completely avoided. It wasn't until I hit, everyone says everyone has their rock bottom. I hit my rock bottom, and then I found deeper levels to go. And it wasn't until that I started to kind of compartmentalize and understand what was happening. I still have a lot of those barriers that you mentioned today. I still have to go to AA meetings because I was a bad alcoholic, and I'm so happy to have been clean, but I still experience a lot of those issues. I can recall I had a moment at work where all my team member did was come to my office. However, the way my desk was set up, every time he would walk by, it would be frightening to me. So every time I'd hear him walk, I would jolt and I would go back to Japan, and I had to react. In one moment, he just said hello, and I completely went off. And I apologized afterwards, and we really addressed like making sure that I could be safe in there for those triggering events, but I hadn't worked in so long with other individuals. I had to relearn that process to get comfortable just in the position and the setting that I was in. And so absolutely, not only does it resonate, some of those things are still occurring today, which is why I say I'm much better than I was in 2009, but I still have a lot of work to do and continue to grow as well. So yeah. Like with Ryan, I've interacted with you, Ryan. You may not even realize this, but I thank you because interacting with you and a lot of individuals in the community really helped to kind of ease my anxiety just working with other men, because that was a problem. I could not, that was a problem for a very, very long time. So again, as I said, it's taken a lot of work to get here, but it's because of assistance from the VA and my supportive team that I've had to train how to recognize when I do have an episode.
Yeah, Timothy, thank you for sharing, and you know, just your bravery and eloquence is so much appreciated. And I think I just have one small comment. I think I really want to nail home and put this in a perspective is that I'm sure when these cases happen, there are so many people that say, you know, why didn't you report? Why didn't you try to get better? If you were that bad, why didn't you do something about it? And there's a whole host of different reasons, right? It could affect your career, personal reasons, all those things that you two just spoke about. And Dr. Karczynski detailed about the avoidance and the guilt and the shame. And I just, you know, I want our audience to just be aware that like that's when you're looking for solutions, and why aren't these people trying to fix themselves if it was that bad? And it leads and it bleeds into that stigma of like false or fake reporting, or maybe it wasn't that bad. There's a whole host of reasons, and we can't possibly fully understand. All we can try to do is empathize with what that person is going through and how lonely and isolating that experience must have been. So, yeah.
And let me just also, when I talk about this subject, and I think the context is so important when you think about when many individuals enlist in the military, and oftentimes it's right out of high school. And we know that oftentimes victims of sexual assault are younger than the perpetrators of lower rank, have less time in the military, and they have a less well-developed repertoire of coping skills. The coping skills you have at 18 or 19 are not the coping skills you have at 40 or 50. And so these individuals, when you think about it, when an individual is assaulted at that age, and maybe also this is the first time they're away from home. This is the first time they're away from their social support. And we know that social support is a huge buffering factor in helping people recover from trauma. So you put all this together and you have a young person who is doing the best they can with their resource that they have and the state of mind that they have. And what unfortunately, what I see so often is somebody who was assaulted early on in their military career at that young age. They didn't have well-developed coping skills. And here they are 10, 20, 30 years later saying, well, why didn't I do that? Why didn't I fight? Why didn't I report? Why didn't I get help? And again, I said, well, let's think about that person at the time of the trauma. You know, what was your state of mind then? Maybe like Timothy, you were in a different country. Maybe you were away from your social support. Maybe there was nobody in your command or in your unit or a peer who believed you, would support you, even wanted to hear about it. And so you cope with this the best you can. Maybe it was drugs and alcohol. Maybe it was self-injury. Maybe it was something else. But individuals try to cope the best they can. Unfortunately, you know, decades later, they don't appreciate that they were doing the best they can, and that's where we see a lot of that shame and guilt. I should have done something different. I shouldn't have been in that position in the first place.
I was just going to make a mention of the comment you made of time of trauma, and I think in my mind the time of trauma can extend beyond it extends beyond the event. Because as much as you might try to avoid, I think there's always a nugget in your head that is gnawing away. So that time of trauma can last for a very long time, and even the event can be extended for almost an infinite amount of time. And if you're continuously feeling anxious about that event and that trauma, that only amplifies everything in your head and affects everything from your physicality to your mentality to your emotions, everything. It can really bleed down.
And Dr. Karczynski, I was gonna add, that was the breakthrough, one of the breakthrough moments, but that was one of the first breakthroughs that I had was hearing my therapist tell me, like, you know, my reaction to that was normal. For a long time, was like, my reaction is abnormal. I shouldn't have acted this way. I should have acted this way. I should have done this and that. But when I heard my therapist say, you're reacting normally to an abnormal situation, that clicked. I was like, oh, wait a minute. Okay. Because as you said, I was 19. My goal, I didn't really know. I knew of tailhook, but my thought pattern joining the military was, oh, the military took care of that. That's not a thing. I had went over so many reasons of what to expect in the military. Sexual assault was not on the list, and it wasn't on the list because I was like, I'm willing to give my life to my brother, my sister. There's no way that they would do that because, and so that was really a shock to the psyche, but that was a great moment in therapy when they said you reacted normal. I was like, okay, I am normal. I'm not this unicorn.
Dr. Karczynski mentioned also that you weren't with your normal social network, but Timothy, maybe you talking earlier about how your family sort of prompted you, dragged you into the VA. Can you talk a bit about how your family helped you and how you decided to trust them?
Great question. It took time. There's a group of individuals. There's a group of about 5 or 6 people that I was with in Japan. They made sure I got home. If it wasn't for them getting, like, every day, it could have been my last. I was in a really bad state. But as you're right, the drinking and the drinking was what got me through. And then it was because of them and their trust level that helped me trust my family. Sadly, I told my mom something happened. I never told her what it was until after I'd met Kathy Munson. That was the first time that I told my friends and family in detail what I'd gone through. What really helped get me through is that they were just there. They listened. They didn't judge. They created a safe space. I was just that, although it was Wild Jonesy, they allowed me to be. And that was so comforting for them. My family, same thing. My mom never once did she ask the question of what happened. She just knew that I would eventually come talk to her. She didn't expect it to be 10 years. But she allowed me to come through on my own time, and I'm so grateful for that. That was helpful. But family, just being family and listening, those are the things. I've been around so many people who they would look at me and they would immediately make an assumption, and 9 times out of 10, the assumption they made was a negative assumption of me, which created a barrier. And those were the moments that I remember, and it's just my family and friends not doing that allowed me to kind of go forward to the next day and to have that hope. I deep down inside, I knew that if I could somehow hold out, that the services and the resources would catch up. I knew that. I just at times forgot that. I had 4 attempts to complete suicide. I had episodes, so I forgot it. But yeah, it was my last attempt. It was an eye-opening experience where I was so grateful to be here. I have to get back into work. But yeah.
Before we get to some main questions for Dr. Karczynski, I want to ask maybe some tough questions of the military here. And I welcome the honesty of our veterans and Dr. Karczynski here. One is there something about the military culture that encourages, promotes, or invites sexual assault?
I would, Ryan, you know what? Ryan, you go with the first crack of that.
Not an easy question to answer.
I don't know. I think, again, that's maybe a little unit dependent. When exactly what Timothy was describing, when you're first indoctrinated in the military, it is about self-sacrifice and your principles and doing something to be part of something bigger than yourself. And you have this belief that you are then a part of something bigger than yourself, and that everyone else there is equally as dedicated as you are. What the truth is that, just like there are bad people in the civilian world, there are bad people in the military world. I don't know how to answer whether there's something about the military culture that promotes that. Everything that I've seen in my personal experience has been against that, but there is a sense of, are some of these units not focused on the right thing? Is there a sense that is something that is toxic that then leads some person to think that this would be permissible, that this is somehow a display of the attributes that the military wants from me? And I don't know. Personally, I've never seen anything that makes me think it's a broad culture issue, but I can certainly respect and even believe that there are units out there where this is permissible, or that it's not taken as seriously as it should, or that it's not actively put in the proper context, and that it allows these things to happen. I certainly think that is possible. Yes.
Ryan, I would add to that. When the question was just asked, I didn't know that was going to be my answer. But after hearing you, my answer is, it's not the military culture. If you look at what the military is designed to do and the system, it's designed to get the mission done. I do believe it's the people that are in the military. As Ryan said, there are just bad people, no matter where you go, who have ill intentions. I may not know just wherever they are in their life. I believe it's the people that wear the uniform that create the culture. If you are looking at a military being so much, it's much more, it's the majority of us are men. So you have a hyper masculine culture that is at some point still trying to exist. What is a man? What is a man supposed to do? And all of these things. And I, in thinking about it, fell into that. You know, I just thought sexual assault was a female issue. I didn't think it was a male issue at all. So I even joined blind to that. So as I got smartened up, as they say, because I had to go through that experience and I had to learn that. And I think today is a microcosm of that. I think it's a lot of bad people coupled with biases that may, instead of individuals, sometimes it's easier to say, I just don't know how to fix it, and then ask for help. In the military, we don't necessarily do that. Asking for help, no, we got to figure out the solution, and we got to figure it out now with zero resources. And I think it's a little bit of more so the people behind the uniform, not necessarily the military. There's an aspect to the military, but I think the majority of it is the people behind.
And I would just say from a few decades of working with veterans who've been sexually assaulted, and some of the common themes that I hear, that they oftentimes, this is where the self-blame comes in. You know, I did something wrong, either in inviting it, not fighting off, being intoxicated. I did something wrong. And one of the points that we hope people get to in recovery is that what happened to you was a crime. And this is why I don't have a problem with the label of victim, because I think that delineates who the perpetrator was. And this was a crime that happened. This was not something that was a stain on your unit. And if you come forth, you'll somehow be speaking badly of your unit. This is a crime. And I think calling it out for what it is, it's criminal behavior. Sometimes I will also hear, well, this happened as part of a hazing or a unit ritual. And I clarify, no, this was a crime. And we need to call it that. And we need to recognize it as criminal behavior and pursue it as criminal behavior like we would in the civilian world. And I think that that's not the only reason, but I think that really contributes to kind of where we're at in terms of this ongoing issue in the military. This is a crime, and we need to treat it as such.
Yeah, I do want to add one thing that is unique to military sexual trauma, and that's why it has its own terminology, is that these crimes are existing in a hierarchy, in a rank structure, which could make a person feel even less likely to report. So when you talk about the environment and is there something that encourages this? Well, I think that what could be possible is that a potential perpetrator may feel more freedom to do so because they have authority. They have real authority in that environment, and they may be able to do things where they have a sense of entitlement or authority, and which would lead them to think that they could get away with it, or that it's okay, or something like that. So in that term, in that way of thinking, I think, that the environment is applicable.
Ryan, it's great because my thinking started to go towards leadership, and knowing that you have been in a leadership role in the Army. How have you conducted yourself and your men and women, and when you deal with something like this topic in training, what is your go-to? How do you work through it?
Well, that it's completely unacceptable, and there's a lot of people that we have this military mindset of risk mitigation and what do we need to do, and all girls or guys, but especially girls, should have a battle buddy at all time. And we talk about, and part of the training we talk about is how you dress and so on and so forth. But what has always been my go-to is that regardless of the situation of another soldier or another service member, it's never okay to do this to someone, to sexually assault or sexually harass them, right? It doesn't matter if they could be, drunk and naked and passed out on a couch. That doesn't matter, right? The act itself is not okay, of taking, of sexually assaulting or sexually harassing somebody. And I think where leadership really has to shine is in the little pieces of that spectrum that Dr. Karczynski talked about, is seeing the little things that seem harmless, that are just comments, or things like that. And you have to, as a leader, silence is consent, right? If you allow something to happen in your presence and you don't say something, then you have failed. If a cat call is made or an inappropriate comment is made, then as a leader, you need to say that's not acceptable. Mm-hmm. And sometimes that's hard for people.
I want to move on to our questions for Dr. Karczynski about the VA here. What additional needs has the VA identified to assist survivors of MST?
So one of the biggest things that I think we always have our eye on is getting folks enrolled in VA, letting them know that services are available. And not only are they available, they're available for free. They're available at every single VA across the country. So much of it is educational. Every VA facility has an individual in the role that I have as military sexual trauma coordinator. And so it's actually very easy to get in touch, regardless of where you live. You can call that location's VA and ask to be put in touch with the MST coordinator. So one of the things that VA is doing is we are training our telephone operators. If you get a cold call and somebody says, I'd like to speak with the MST coordinator, our telephone operators are trained to direct that call to the appropriate person. And this is actually tested throughout the year. So, I mean, it's these little things. If somebody calls in, takes that step to make a call, they are immediately connected with a facility's military sexual trauma coordinator. So we want to remove as many barriers as we can. So that's, I think that will always be one of our first and foremost missions, is to provide education, just how to bring veterans into services.
And as Timothy talked about, that first step of just making that call can be a very big step.
Absolutely.
Mm-hmm.
It could be, and it's honestly, it's the hardest step, is reaching out that first time for support. Because at that moment, you might have created some barriers. You may be in a life situation where you're having to focus on that, about deaths, and that take precedence over that. So when you make that decision, when you get to a place where you can ask for help, that's so important. And I want to stress that is so important and so big. You should be very, very proud of yourself. I exhaled after I had that 3 hours with Kathy. I finally was able to release that. And ever since I've released it, the biggest fear that I had was by releasing this and sharing this and speaking over it again. Number one, is it going to happen again? And I thought about, how am I going to be perceived by doing this? And I just got to a place where it was more important for my recovery. And I will never, my first therapist, when Kathy said, I cannot promise you that you'll be better than before this happened to you. I can't promise that person will ever be back. What I can promise you is that you will be better tomorrow than you were today. And I said, you know what? Sign me up. I looked at my life. I looked at what had happened, especially over the decade. I said, sign me up for that. If my tomorrow is better than where I am today, I will take it, because I had lost all hope at that point. At that point, I'm so happy where I was at that Kathy intervened, because I was at the end of my rope at that point. So it was either survive or die. And I remember that was when I had to make that choice. It was, do I want to become one of the 22? Or how am I going to transform my life? I had no idea how it was going to happen. I just subscribed to, it's got to be better than this. And I'm so happy that Kathy and everyone else who's come into my life since then been a part of that journey, of this journey to get here. That's my hope and my prayer. I want every victim to move to Survivor once they move to Survivor, and then I want every survivor to be able to thrive in the new normal. My new normal, I didn't even think it would be this good. Mm-hmm. And sometimes I have to I have to talk to my therapist. Sometimes I have that issue. I'm like, wait a minute, I shouldn't be this happy. Something's wrong. I couldn't. It's not supposed to be this way. And I'm learning learning new ways to cope, and I'm blessed for it, but it's been scary. So
well said, Timothy. Go ahead, Ryan.
Timothy, you've gone out and spoken about your experience to military audiences, correct?
That's correct. Yes.
And how has that been for you?
It's been great. I had to. I laughed because I had to learn something. I didn't. I started in 2015, and since until today, it's been over 25,000 service members and college students, which is a number that has blown me away. However, being able to go out there, it allowed me to see the resources in the SHARP program, the SAPRA programs, all the different branches. And I was able to see with my own eyes how far the system has come since then. It has given me a new lease on life. I'm serving in a different capacity now. The reason I laughed in the beginning is because I used to tell individuals that the stage was my therapy. I would go out, that's my therapy. I go out there and I share my story, and it's also therapeutic for me because I'm taking back a little bit of my ownership. And I will never forget, I was at an event with an transformational speaker, Lisa Nichols, and the first thing she said was, the stage is not your therapy. And it was like a gut punch. And she says, you do your therapy before you get out on the stage. The stage is the audience's therapy. And so it transformed the way I looked at my recovery, because I had been saying that. I've been saying it to my therapist. And when I heard it again, I had to hear it a different way for it to click. And so it allowed me to do more work inside that room with my therapist before I got out on the stage. Now, having said that, it has been beautiful to see on the stage, and you can see survivors. Like survivors, we know one another. So when I'm out in there and I'm speaking, I'm seeing the survivors, I'm seeing it, and it is we're having that understanding that, you know, you're not alone. I'm seeing it click with them, and that has been transformative for me. And I'm so happy I do my therapy before I get out on the stage now, because it is very important to the person in that audience who's like me at a point that felt like they were alone. Nobody's listening. They have no support. For that moment, they're like, wait a minute, I'm not alone. There's another brother out here who's experiencing that, and I can reach out to. I take that very, very, very seriously. And I think it's part of my recovery now is to get out there and do it. But I'm also, again, very mindful that I'm also a survivor, and that I also have to do my therapy. So there have been moments, I think that there's 2 years ago, I lost my mom. I couldn't be out on the stage because I had to take care of me. I had to make sure that I was in a place where I could do that. And even when I have had episodes, I have to be mindful of that. I can't save the world if I can't pay my light bill. And that means taking care of myself mentally, physically, and emotionally.
Dr. Karczynski, how can a veteran access MST-related care?
It's as simple as enrolling, and you can talk to your primary care doc. That's actually the biggest pathway to getting individuals into treatment is through primary care. Very few people just find my name and call me, although that's totally fine too. A lot of time it's through primary care. And because we have this universal screening, a primary care provider will ask a veteran about those experiences and will direct a person into appropriate care, whether it's trauma-focused care or for depression. Or again, I've gotten cold calls. And like I said, that's totally fine too. Sometimes I will get somebody directed my way through VBA. And there is a difference between VHA, which is the treatment side, VBA is the benefit side. But sometimes a VSO or a representative from VBA will direct somebody to me directly. It's a very easy process. Again, because every every facility has a military sexual trauma coordinator. I'm not working alone. I'm part of a team. I have many more colleagues today who are doing trauma work than there were when I started 20 years ago. So there are many people who do the kind of work I do, who are really passionate about doing this work. So it's easier just contacting your nearest VA. Mm-hmm. And I want to say something. Timothy used the word recovery so often, and I think that is an excellent word. And just as not every victim of sexual trauma has the same reaction, people's recovery looks different. And at the VA, certainly for VA Pittsburgh, we do recovery-oriented treatment, and we are relying on evidence-based psychotherapies. And what that means is these are psychotherapies that have been researched and studied. They are now the gold standard to help people recover. Now, many decades ago, and I'm thinking of our Vietnam era veterans, and they may have been kind of tethered to the VA for decades. And maybe the message was, you'll never recover from PTSD. Well, just as medicine has evolved, psychotherapies have evolved, and we don't think about PTSD in the same way. We know a lot more about avoidance. We know a lot more about helping people process their traumas, finding out where they're still stuck. I talked about guilt and shame and self-blame. A lot of times, if a person is blaming themselves for the trauma, they're not going to recover. They're going to stay stuck. So working with individuals to help them identify where they're stuck and helping them in that process of seeing the assault accurately and figuring out where they're stuck, helping them learn the tools so they can process those things and work on their own recovery is key. And so our goal is to help people recover and help people really get back into their lives. Now, that is our goal, and that's really how we approach treatment at the VA. There are a number of different evidence-based psychotherapies, but that is really what we're focused on at the VA, because that's what we're seeing through evidence and through the data that helps people recover and get back into their lives.
And Timothy, you mentioned earlier that either if you go to the VA, but you could also go to the vet center. And Ryan, you work at the vet center. How can a veteran contact a vet center, and what do they expect whenever they walk in the door? What should they expect?
Yeah, we're very similarly set up. We are part of the VA. We're all VA employees, although we are not a part of the hospital where Dr. Karczynski is, but we do a very similar work, and we typically work in concert with the office at the hospital. So it typically for survivors of military sexual trauma, it's more a convenience of where we are located or the counselor that they become connected with, but getting connected with counseling at a vet center is very similar. If you just call us, we can enroll you on the spot. You don't have to be enrolled in VA healthcare to come to a vet center. So that's the primary difference, is you don't have to enroll in VA healthcare to come to a vet center. But in most cases, as I said, we work in concert with the resources at the hospital for this type of work.
And it's also anonymous, am I correct, at the vet center?
Yes. So everything at the vet center is confidential and free for all the services that we offer here. So we actually don't share our records with the VA hospital. We can see VA hospital records, but they can't see ours. And the the Department of Defense can also not access vet center records. So that is one of the reasons that we are a little bit different. Yeah.
Okay. I want to thank all three of you for coming on for this really important conversation. But I also want to make sure that if there were any points throughout the last hour or so, I figured it'd be a longer conversation today, but if there's any points that we did not touch upon, I wanted to have a moment here to address any of them. But I wanted to go around the table here, proverbial table here, and see if there were any final words. Timothy, can we start with you, please?
Sure. My final words would be to each and every one of you who are watching, who are listening. You are not alone. I see you. I hear you. We believe you. The VA has been a godsend to me. I please go get enrolled into the VA. If you are uncomfortable with the VA, please go to the vet center. I do not want anyone to take a decade of their life and not go. I was so wrong at what I thought, and I just don't want anyone else to wait that long. And also, you are your best advocate. I learned that. Advocate for yourself. If you go to the vet center or the VA and you may not have someone that's paired with you, you can share that and you can get it changed. It is all tailored for you. Seek out the services. I am with you. I am with you in spirit. I am with you every single day. You are not alone.
Thank you, Timothy. Dr. Karczynski?
So this year's theme for Sexual Assault Awareness Month is "We believe you, and we believe in you." And I can't stress that this is accurate. And for me personally, as I mentioned, one of the most challenging parts of my work is feeling for veterans who are carrying these burdens around for decades. And so my final word would be, it doesn't matter if your assault happened last year or 20 years ago. The recovery is possible. We are here to help you. We have excellent clinicians. We have a great team. We have great partners in the vet center, and we are here to help you. And so again, it doesn't matter if your assault was a year ago or 30 years ago, please come see us.
And Ryan?
Yeah, I think I would just love to reiterate what Timothy and Dr. Karczynski said. Take care of yourself. There is nothing to be ashamed of to say, I need to speak with somebody, whether it's a little thing or a big thing, and whether it's related to a military sexual trauma or not. If you feel that you need to speak to someone, that is always helpful, and our doors are always open at the VA and at the vet center, and with your friends and family. So that would be my last words.
I'd like to echo that from Timothy as well. Take that step. It's a big step. It's the hardest step, but as soon as you take it, I appreciated the word exhale. You can exhale. Well, I want to thank our audience for listening, and I want to thank our guests here. This, again, was a two-part episode of the Scuttlebutt talking about military sexual trauma. We will be coming back at the end of April to discuss PTSD with Ryan and another Ryan. Is that correct? Ryan?
Yep.
We'll be talking about that. So thank you again. And if you need to reach out to the Veterans Crisis Hotline, again, that number is 1-800-273-8255. We hope to see you all back again for the Scuttlebutt. Thank you again, everyone, for joining us for another episode of the Scuttlebutt. I want to thank D&D Metal Recycling and Auto Salvage for their generous support and sponsorship of this program. You can find their locations, get quotes, and ask about availability at D&Dautosalvage.com. That's D&Dautosalvage.com. We'll see you next week here on the Scuttlebutt.